Welcome to Part 4, Communication Strategies Continued. Last time we talked about the universal precautions approach, using plain language, and choosing patient-friendly materials. Now we will discuss the Ask Me 3 strategy and practice with the teach-back method. Let's start with a strategy to help empower patients to be active participants in their healthcare, the Ask Me 3 campaign. The video in the second lecture showed us how healthcare settings often usually almost always make patients feel less comfortable in expressing themselves than they would otherwise be. For example,
any questions?
What kind of service plan does this come with?
Unlimited.
Can I keep my same phone number?
Absolutely.
How do I change the ringtone?
Just hook it up to your computer.
Does it have a camera? What's the warranty? Does it come in silver? Can I put my party shuffle on this? Does it have a 3.5 millimeter headset jack? You sell a lot of these?
It's the one I carry.
You ever get those phantom vibrations in your pocket?
Any questions?
No.
Are you sure?
Yeah.
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
Ask Me 3 was developed by the Partnership for Clear Health Communication, funded by Pfizer. It was written to help encourage patients to be active in their visits and empower them to be sure they know the answers to the 3 questions at the end of every visit or conversation with a healthcare professional. Making sure that you, as a healthcare professional, provide the answers to these simple questions will help you give what the patient needs to know most regarding their diagnosis, treatment, and context. The 3 questions are: what is my main problem? Explain in plain language what their diagnosis is. What do I need to do? Tell them what they need to do. What is their treatment? Why is it important for me to do this? Provides context and motivation for the patient to continue their treatment. The Partnership for Clear Health Communication is a national nonprofit coalition of organizations that are working together to promote awareness and solutions around the issue of low health literacy and its effect on health outcomes. Here's a video demonstrating how the Ask Me 3 can work in a healthcare setting.
As a patient, you should expect safe care, and you should also take steps to help ensure you receive safe care. Clear communication between you and providers and being an active member of your healthcare team is important for keeping you healthy and safe. Asking your doctors, nurses, and pharmacists and other healthcare providers questions so you understand your main problem, your plan of care, and what you need to do for your main problem is an important first step. Now, more than ever, patient and family engagement is needed to help you receive the best healthcare possible. You are an important part of the healthcare team. Be an active member of your healthcare team. Ask questions early and ask questions often. The National Patient Safety Foundation encourages you, the patient, to be an active member of your healthcare team by asking 3 simple but important questions every time you talk with a healthcare provider. The 3 questions are: what is my main problem? What do I need to do? Why is it important for me to do this? Ask Me 3. Good questions for your good health.
Joe, I think your shortness of breath and swelling are caused by congestive heart failure. We need to schedule an echocardiogram to find out what the cause is. The echocardiogram will determine your ejection fraction and if there are any underlying issues with your heart valves. In the meantime, I'm going to start you on a couple of medications: Lotensin for your high blood pressure and Lasix for the swelling.
Okay,
Do either of you have any questions?
so I have high blood pressure. Is that my main medical problem?
No, high blood pressure is not your main problem. Your main problem is congestive heart failure. This condition causes your heart to be weaker and have to work harder to pump blood through your body. It can cause swelling in your legs, and it can cause shortness of breath.
Okay, I think my brother may have the same condition. What do I need to do?
First, before you leave, let's schedule an appointment for your test. After you leave, you need to get your 2 prescriptions filled. And finally, you need to take your Lotensin and Lasix. I suggest that your daughter and you write up a schedule for your medication.
A written schedule of my father's medications will help. Why is it so important for him to have the test and take these medications?
Those are really good questions. The echocardiogram will hopefully tell us exactly what's causing the heart failure. The test will also help us find out how far along the heart failure is. It's important to take your medications because you're helping your heart not work as hard. The swelling will decrease or disappear, and you're slowing down the disease. Does that help you understand why the test and medications are important?
Yes.
Yes, I understand. I'll make sure to schedule my tests and take my medications.
In this scenario, Joe asked 3 simple but important questions. By asking questions, Joe was able to be more informed about his main problem and everything he needed to do. Also, his family member was seen writing down the information. When you visit your doctor, if you're in the hospital or at the pharmacy, always ask and write down the answers to these questions. What is my main problem? What do I need to do? Why is it important for me to do this? For more information about Ask Me 3 and communicating well with your healthcare providers, visit www.npsf.org.
If you can encourage your patients to ask these 3 questions, and then you can explain their diagnosis, treatment, and the context in clear, understandable language, they'll be more likely and more empowered to ask these questions in other healthcare settings as well. Now let's discuss a very important tool in improving our communication, the teach-back method. So what is the teach-back technique? Basically, it's asking patients to repeat back in their own words what they understand from what they've been told. It is not a test. It's a way to let you know how well you've explained a concept. And it needs to be completed in a non-shaming way. It's important that the patient recognizes that it's to make sure you explained everything correctly, not a test of them. Using teach-back provides you with the opportunity to confirm what the patient really understands and reteach if necessary, right there while they are still in the office with you. Doing this in real time can help reduce potential medication errors and mistakes with care instructions. Who here has ended a conversation with the question, "Do you understand?" I know I have. When we use this with our patients, they will most likely nod or answer yes, but you won't have any idea what they really understand. Teach-back will replace this more common question and provide you with the chance to know what the patient understood from what you said. Does anyone have any examples of where teach-back worked or where it didn't work or at home? Not only is teach-back a good thing to do, but it's supported by research. In fact, the Agency for Healthcare Research and Quality considers teach-back one of the top 10 patient safety strategies. Another study showed that when physicians used interactive communication techniques like teach-back, diabetic patients had better glycemic control. Here are some ideas of how you might do a teach-back. What will you tell your husband about the changes we made to your blood pressure medicine today? I want to be sure I explained everything clearly. Could you please explain it back to me so I can be sure I did? If you're teaching how to take medicine like injections or inhalers or how to dress a wound, you might ask, "Can you show me what you will do at home?" It's important not to appear rushed, annoyed, or bored during these efforts. Your affect must agree with your words. When using the teach-back, remember not to overload the patient with too much information before asking for understanding. Don't wait until the end of the visit. Ask throughout the encounter, chunking information into sections and checking along the way. And do not ask, "Do you understand?" Asking yes or no type questions doesn't help you know what the patient really understood. Remember, asking more open-ended questions is the key to a successful teach-back. Clarify and check again. If teachback uncovers a misunderstanding, explain things again using a different approach. Ask patients to teach back again until they're able to correctly describe the information in their own words. If they parrot your words back to you, they may not have understood. Practice. At first, you may want to try teachback with the last patient of the day. Once you're comfortable with the technique, use teachback with everyone every time. It will take a little time, but once it's part of your routine, teachback can be done without awkwardness. Seriously. And it doesn't lengthen a visit. Use handouts along with teachback. Write down key information to help patients remember instructions at home. Point out important information by reviewing written materials to reinforce your patient's understanding. You can allow patients to refer to handouts when using teachback, but make sure that they use their own words and are not reading the material back verbatim. Use the show me method. When prescribing new medicines or changing a dose, research shows that even when patients correctly say when and how much medicine they'll take, many will make mistakes when asked to demonstrate. For example, you could say, "I've noticed that many people have trouble remembering how to take their blood thinner. Can you show me how you're going to take it?" The show me method may seem unnecessary when you're already using teachback, but here is the data showing that even when people can read the instructions correctly on a pill bottle, represented by the yellow bars, they may not understand how to follow them. The green bars represent the people who actually took the right amount of pills when demonstrating, a lot less than people who were successfully able to read the instructions. Now let's see an example of the teachback method in action.
Now here's your copy of the after visit summary that we just went over. Now I want to be sure that I did a good job explaining about asthma and your inhaler. What will you say to your family when you leave the clinic today?
Well, they know I had the appointment, so they're going to want to know how it went, and I'll just have to let them know. The doctor says I have asthma and that I need to start using an inhaler.
Yep, that's right. Can you tell me a little bit about asthma? You can start, and I can fill in some details.
Sure. From what I understand, my lungs get clogged, and it makes it hard for me to breathe sometimes. And one of the things I've been told to stay away from are smokers.
That's right. Let's take a look here at your after-visit summary and then also this packet called Managing Your Asthma. And you're right. Asthma can cause the airways in your lungs to get inflamed and constricted, making it hard to breathe. But your inhaler will help things open up so you can breathe a little bit easier.
Okay.
And I'm glad you mentioned smoking. Staying away from smoking is the right thing to do, along with staying away from these other things listed here in your packet. These things are called triggers. And can you think of any other triggers that might be around you?
Yeah. One in particular, our neighbors, we do a lot with our neighbors, and they have 2 old English sheepdogs, and they're always with them. And when they come over to our house, those dogs always are leaving big clouds of fur behind, so I'm sure that's something I'm going to have to start keeping an eye out for.
Yeah, that's right. Sounds good. Now, you said you work full-time?
Yes.
Okay. When do you think you'll be able to use your inhaler?
Well, I plan on using it in the morning when I get ready for work, and then I'll plan on taking that second dosage when I get home from work in the evening.
That's perfect. That's exactly what the doctor has written in your instructions here on your after-visit summary. And also on this after-visit summary, you can find the steps that we went through on how to use your inhaler.
Okay. No, this will help, because I know when I leave here I'll probably forget half of it, and I know when I tell my family I'm going to have to start using an inhaler, they're going to be asking, well, how often are you using it? And I'll be able to show them this and let them know exactly what I need to do.
That's a great idea, to have this and this packet out and available for you or your family to grab if you need to. That's great. Now, before we leave, would you show me how to use your inhaler?
Sure.
Looks like you got it. Now, feel free, if you think of any questions, definitely call the clinic.
Sure. Thank you.
You're welcome.
And see, she even used the show me method. Here's a quote I like to keep in mind. "It is neither just nor fair to expect a patient to make appropriate health decisions and safely manage his or her care without first understanding the information needed to do so." Let's finish with a final activity to practice and put together everything we have discussed. If you're watching in a group, break up into pairs to role play. If you're solo, just imagine the scenario between a doctor and a patient. For each scenario, use the doctor's line given as a starting point to imagine how this interaction could go, or to role play with one person being the doctor, one person being the patient. Like we did in the plain language exercise, imagine what words might be commonly used by a healthcare provider and see if you can come up with clearer language to use. Using the Ask Me 3 model, have the doctor convey only the main points / important information to the patient. Feel free to make up facts for these scenarios. This is not meant to test your knowledge of the topics presented in these scenes. Imagine, or better yet, look online for resources that the doctor could offer the patient that would be helpful teaching aids. And be sure to use the teach-back method if you're playing the doctor or imagining the conversation in your head. What lines could you use to check for understanding? I'll now scroll through the 3 example scenarios. Pause the video on whichever one you pick for this activity. Then hit play again and we will wrap up the lecture. Scenario 1. Scenario 2. Scenario 3. We need to be constantly reevaluating the way we communicate with our patients. This is an example of a patient communication self-assessment form you can find on the AHRQ website in their Health Literacy Toolkit, which reminds us to use clear communication, including the strategies we discussed in these lectures, with every single one of our patients. I encourage you all to download a copy and keep it handy to test yourself. There are many great resources out there for health literacy education, and here are some particularly well-done projects which formed a large part of this presentation. Over the course of the last few lectures, we've talked about the definition of health literacy, why we should care, some consequences of low health literacy, who is affected, and what is it like to have low health literacy. And we've discussed strategies for effective patient communication, including the universal precautions approach, plain language, user-friendly materials, the Ask Me 3 campaign, and the teach-back method. I hope you found some of this information helpful, and thanks so much for listening.